Ghana, welcome to another exciting episode of Fruits of the Womb, your authentic source of maternal and child health information. My name is Dr. Vera Bayu. It's been reported that the number of cases of type 1 and type 2 diabetes in children is on the rise, with the U.S. reporting 15,000 type 1 cases and 3,700 type 2 cases annually in their children. What is the situation like in Ghana? Today on Fruits of the Womb, we discuss diabetes in children. We'll go on a quick break. When we come back, I'll introduce my guests. Stay tuned.
Your presence has changed my life. Your tenderness makes me want to take care of you forever. And I promise that I will give you nothing but the best always. Cousin's Baby with natural ingredients also gives the best care for baby's soft skin and hair. Cousin's Baby, growing together naturally. From your first shopping list to the very first sound you made, to your first bar, your first date. You've brought me so much joy, and I promise to always protect you. Camel Baby Antiseptic with a mild formula protects your baby's delicate skin from germs and bacteria.
So welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cousin's Baby and Camel Baby Antiseptic. Join us on our Facebook page. Go to Facebook, type Fruits of the Womb, and you can post your questions, comments, and contributions. We're also streaming live on YouTube and on Facebook as well. Today on Fruits of the Womb, we are discussing diabetes in children. And to help us to discuss this very important topic are two very lovely ladies in studio with me. On my extreme right, a familiar face, is Dr. Mrs. Nanaya Echan Bonnie. She is a resident pediatrician at the Kolebu Teaching Hospital. Welcome, Echan.
Thank you.
And on my immediate right is another Dr. Mrs. Efua Kwachua Osiu Jemfi, also a resident pediatrician at the Kolebu Teaching Hospital. Welcome, Efua.
Thank you.
You're looking very lovely.
Thank you.
Yes, so diabetes in children. In the first place, what is diabetes, and is this something that can really affect children?
Okay, thank you very much for having us. Diabetes is a chronic metabolic disorder which is evidenced by either insulin deficiency or insulin resistance. Now, insulin is a hormone that is produced by an organ in the body known as the pancreas. The pancreas has a certain type of cell which we term as the B islet cells, which are responsible for producing insulin. Insulin helps in the uptake of glucose into the cells from the blood, which enables the body to be provided with energy for its daily use. Now, with that in mind, I have to say that there are two types of diabetes. We have the type 1, where the individual is unable to produce insulin. So you have insulin deficiency, and then that's the type 2, which develops when you have insulin resistance.
Dr. Mrs. Osiu Jemfi, what causes diabetes in children? Or are there any known risk factors that we all need to look out for?
So in children, the main type of diabetes that is really common is the type 1 diabetes. Okay. So that one, the exact cause is unknown. But if you have a relative, say your parents or any of your siblings having diabetes, then you have a higher risk of getting diabetes as compared to someone whose parents or siblings don't have diabetes at all. And then we also have some individuals whose parents don't have it, but then their genes, the genes that make up their body, predisposes them to getting it. So getting very little infections can actually cause their bodies to start harming their cells, the islet cells that Dr.
In the
pancreas.
pancreas.
In the pancreas.
Okay.
And then it could also lead to they producing no or very little insulin. And then it's also said that for the environment, we also talk about those people having if you breastfeed for a long time, then you have a lower risk of getting the disease. And then if you introduce formula foods into your into the diet of the child early, then you have a higher risk of getting diabetes in children.
So mothers out there, one more reason to exclusively breastfeed and also continue breastfeeding till your child is how old?
About 1.5 to 2 years.
1.5 to 2 years.
Yeah.
And then we have the type 2 diabetes, which is not very common. In the United States, they are recording about 3,000. Now, for the type 2, it's also becoming more common in Ghana, mainly because of the high increase of obesity among children. So you see that there was a research that was done that found out that more people in the middle class and then upper class their children are becoming obese. And the bigger you become, the higher your risk of getting the type 2 diabetes, which is the same as the diabetes that is found in adults.
What are the symptoms like for children? Is it the same as adults? Is it different? And how does it differ?
Okay, so the symptoms are varied. First off, the child will have increased demand for drinking water. They will have increased thirst, which we term as polydipsia. And then as you take in more water, it means that you're going to pass it out. So you have increased frequency of passing urine, that is polyuria. Then at night too, they'll be passing urine very often, that we term as nocturia. Now for children who already have bladder control, you realize that now in the night they'll be wetting their beds, and that is an early sign that a child is developing
Probably
diabetes.
has diabetes.
Yes,
so
please.
a child who previously used to be dry at night suddenly starts bedwetting. It could be. It doesn't necessarily mean that your child has diabetes, but it could be that your child has a problem, has diabetes.
And then you also have other symptoms such as excessive eating, which we term as polyphagia. And then for children who develop weight loss, even though they are eating very well, it's also one of the symptoms that children with diabetes present. Now, when children develop some type of complication from, I must mention that type 1 diabetes, which is diabetic ketoacidosis, they develop symptoms such as anorexia.
These are big terms.
So anorexia.
These are two big terms for my viewers. Please break it down for us.
So they have lack of appetite.
Okay.
They have vomiting. Okay. And then they feel nauseous. And then they also develop abdominal pain, which I think is easy for you.
And that's because the sugar has gone so high in the blood that and their body is unable to make use of it.
Sugar.
So do you see that many cases of diabetes in children? And what's the youngest age you've seen? I remember seeing a 2-year-old when I was doing house job. 2-year-old with diabetes, and I'm told that there are even some that are younger.
There are some that are younger. We have neonatal. Sometimes when you give birth, at birth, some babies will have very high blood sugars, and then that is what we also term the neonatal diabetes. And for the neonatal diabetes, sometimes it will resolve. It will resolve before the child is 1 year. And for that one, you can say that it's transient. But those people who we diagnose as having diabetes in the newborn period, it can also
progress.
Yes, in the adult period, it can manifest again. And then we have those in the neonates, newborn period. If you are diagnosed, we have the other type. About 50% of them will continue to have it and then through to adulthood.
So, Mrs. Bonnie, what are some of the complications of diabetes in children? We'll talk about treatment later, but let's look at how the disease manifests.
So, diabetes affects the vessels of the heart and then also the vessels in the body in general. Now, from the head coming downwards, so it affects the vessels supplying blood to the brain, and the patient may have a stroke. In certain
so you may have stroke in a child.
You may have stroke in a child. And then in a complication with type 1 diabetes, they may develop diabetic ketoacidosis, and the child may come unconscious. So the child may come even in a coma, in a comatose state. Then it also affects vessels going to the eye, and it manifests as glaucoma, as cataracts. It affects vessels that supply blood to the heart as well. The child may develop something we call an angina and may manifest with symptoms of chest pain. Then we go to the kidneys as well. So the child may develop renal impairment or problems with the kidney. Yes. Then it supplies, you know, it may affect vessels that supply the nerve endings. So you may have the child developing neuropathic pain. So you may have tingling sensations.
Numbness.
Yes, numbness, paresthesia. Yes. And then with that in mind as well, the child may even develop leg ulcers. Okay. And then they also have risks of poor wound healing, which may be a complication of the diabetes.
And that's because the small vessels that are supplying those parts of the body are impaired, are affected.
So when you look at it, diabetes in itself is a multi-system disease. So it affects almost every part of the body.
Dr. Osei Ojemfi, would you want to add anything?
Most of them will not become as big as they should. So instead, maybe a 5-year-old girl, she doesn't look 5 years, she may look like a 3-year-old girl. And she's very lean. And then sometimes they are just tired. Maybe they used to play a lot. Now they are not playing as much as they should because they are very tired, easily gets very tired. And they have mood changes as well. So you see that a child, there's a saying that a hungry man is an angry man. So they are hungry, even though they are eating a lot, they are hungry. So they have mood swings. Today they are happy, tomorrow they are not. Their friend is no longer their friend and all. And then you also have them not being themselves as well. So those are all the things, like Dr. Bonnie also said, it's a multidisciplinary thing, multi-system. It affects the brain everywhere.
We'll go on a quick break, viewers, so don't go anywhere. There's so much more to come. We'll be right back.
Your presence has changed my life.
Your tenderness makes me want to take care of you forever.
And I promise that I will give you nothing but the best always.
Cousins Baby with natural ingredients also gives the best care for baby's soft skin and hair. Cousins Baby, growing together naturally.
From your first shopping list to the very first sound you made, to your first bath, your first date. You've brought me so much joy, and I promise to always protect you. Camel Baby Antiseptic with a mild formula protects your baby's delicate skin from germs and bacteria.
So welcome back, viewers. This is Fruits of the Womb, brought to you by kind courtesy of Cousins Baby and Camel Baby Antiseptic. Join us on our Facebook page. Go to Facebook, type Fruits of the Womb, and you can post your questions, comments, and contributions. Remember that we are streaming live on YouTube and our Facebook page. We are discussing diabetes in children. Dr. Osei Ojemfi, is it curable? I'm sure a lot of my viewers will want to know that.
Diabetes is not curable, but we can manage it. We can manage it to give the child the life that he could have lived without the disease. But then it would mean that you always would have to listen to what your doctors are telling you. Anytime we ask you to come, you come, and then we continue to monitor the child very well. Make sure that there's always enough insulin in that child's body to keep using the glucose so the child can grow well and live the life that he can, will have enough energy to do what they can do. So basically what we do when you come is, after we have made the diagnosis, we treat whatever things that you came in with, whatever complications you came in with, and then we start giving you the insulin. But the needles are very small, so it's not as painful as the bigger needles that we use. Okay, and then there are different types that we can also use. So we give you the insulin, and then it will help your body use up the glucose that is in your blood, or the sugar that is in your blood. And this has to be
used every day.
It has to be used every day, sometimes twice a day.
And I'm sure you teach parents how to give the shots.
We teach them, so we spend time with them. We teach them when they come to us. We make the child, if you are old enough, the older kids, like maybe around 8, 9 years, or sometimes they are even younger, 5, but then they are very
assertive.
Yeah, they are very assertive, so you can teach them as well. So we teach the children, and then we teach the mothers as well about the places where they are supposed to be giving the injection. And it's not just that. Whilst we are doing that, we also need to keep making sure that the insulin we are giving you is the right amount. So you have to be checking your blood sugar or your blood glucose from time to time, and also your urine as well. Another thing that's we didn't say is you having a lot of glucose in your body predisposes you, or it increases your risk of getting infections as well. And that can also go a long way to cause other problems for you. So we test your urine from time to time to see if you have any infections as well, and also to check how much glucose. If you have a lot of glucose in your blood, some will come out through the urine. So we'll be able to test that as well. So we teach the mothers to do all that. They get the kits. It's not too expensive. You can afford it.
It's affordable.
It's affordable. And then we teach them to do these ones from time to time. Part of the management also involves, like we said, it's a multi-system disease. So you need other people. So I am a pediatrician. I would see the child, but I will need the eye specialist also. They have to go for eye checkups. We want to see has there been any damage to the eye? Is it something that is reversible? They can go blind having the disease. So we need the eye person to also come in and be checking, and we refer you to the ophthalmologist to look at all this for you at the first time we see you, and subsequently as well. We also need the dietitian. It's very important that we have a dietitian in here. The dietitian will take you through the foods that you have to eat to make sure that we don't give you too much carbohydrates, which will become glucose and is sitting in your blood and causing you to not have enough energy. Then they will advise you don't have to give too much fat as well. So the dietitian will come in and
modify your diet.
Modify it, but we don't do things that are abstract. They'll ask you what foods is available to you in your house, and then they'll modify how it's prepared, and it's actually healthy eating. So it goes a long way to help the entire family to eat well and not become too big. Now, when you come to the type 2 diabetes, for them, it's mainly if we are able to help them control their diets and to lose a little weight. While in children, not to lose weight, but to maintain the weight they have. And as they grow taller, then they grow into the beautifully. So when they do that, it all involves the dietitian as well to come in. So sometimes when they come in and it's not so much, we can manage them with the diets and exercise and so many things. We do that for the one with the type 1 as well. So that's sometimes for them, for the type 2, sometimes if you're able to manage the weight very well, you may not progress so much into diabetes. You'll be able to control it.
And they may not need medications.
They may not need medications at all.
Mrs. Bonnie, some rural area where there's no light, how does such a child who has diabetes access treatment?
Trying to acquire the insulin may be a challenge for them in terms of funds, because it will come with a certain cost. And then the storage in itself too will be difficult if you have a child living in a deprived area where there is no electricity, because you know the ideal environment under which it should be stored should be in a cold temperature. So that in itself will be a challenge. Then one of the challenges too that we face is with the administration of the drugs. So the key thing here is education, education, education. So you're educating the parents or the caregivers, you're educating the child as well. So if the child is old enough and can understand whatever is going on with him or her, you need to educate. So we educate on the administration of the insulin, the frequency of the insulin that should be given, and then the dose. Because sometimes if the child or if the caregiver gives the medications in an overdosed manner, it could lead to the blood sugar dropping so low that which is very dangerous. So that in itself can kill the child. So the child can present in an unconscious state or may die. So it's very, very important that we talk to them about the right dosing. So we sit down with them. I must mention here that the insulin that is given, with the syringes are calibrated, so they have numbers on them. So we specify which amount that they need to have, and then we demonstrate it to them. And then we also make them take it themselves, and then they do it for us to monitor, and then we know that they are very comfortable and very confident in the administration before we allow them to go home. Then the other thing,
the storage
too, is
issue.
the storage issue.
I want you to talk to that issue, because
I mean,
that's what I wonder, how someone who is coming from a very deprived community will be able to administer this insulin.
Most of the district hospitals would have insulin. And then we have the chips compound as well. We shouldn't forget about those. When we say chips compound, we need small, it's not a hospital, but we have health workers there. And they have, just like the immunization bags that we see our public health nurses holding. So there are ice packs in them. It lasts quite a while. So you can store some of them in it.
Okay, so it's not a hopeless case.
Not at all.
So Mrs. Bonnie, you were telling us about some of
so the other thing that we also do is to talk to them about compliance. So compliance is very key in the management. We talk to them about the complications, so the need for them to comply with the medications so that they don't have the complications developing. Because if they don't comply, then it means that their blood sugars are not going to be well controlled, and then they will develop all the complications that we have listed. Earlier. Yes. And another thing too is we also have the monitoring. So once they are taking the medications, we need to know whether they are actually administering the drugs and whether the drugs are effective. So we let them maintain something we call a diary. And then every day they mark the amount of insulin that they give. And then when they come to the hospital, we inspect those diaries to make sure that the administration of the drugs are going on effectively.
So viewers, like you know, every week we have the question of the week, where we ask a question on what has been discussed in studio. If you get the answer right, you win a prize from our sponsors. So for this week, the question is:
childhood diabetes is usually A. Type 1, B. Type 2.
Send your answer to the number on the screen. Let's check out last week's winner.
The answer is A.
Congratulations. And we're back. Yes, so we were talking about the challenges, and I'm sure there are several more challenges when it comes to management of diabetes in children. It's a challenge in adults, let alone children. Yes, Mrs. Jimfi.
I think with compliance, like she said, sometimes they get tired with the injections that are being given. They get tired, so sometimes they may not administer it as they should, because they are simply tired of everyday medications and all. So yes, you continue to talk to them and encourage them. And then we have peer groupings as well.
Like a support group.
A support group.
Yes.
So we have one that is also active also on Facebook, that is the Diabetes Youth Center. And then as a doctor that is coordinating it, we have the Greater Accra chapter. We have the, I think it started in Takrade. So we have these people, all children coming together, learning from each other. We know that peer support is something that is so
crucial,
important in managing a disease that you are going to be, that is going to stay with you for a lifetime. Yes. So it's also very important. And there's some challenges that we've also had is among teenagers. We know that adolescents is so difficult managing them. When they get there, they feel that they know better. Sometimes I won't take it. And then some people tend to starve. Okay, so they've taken the insulin shots and they are angry, so then they won't eat. Very dangerous. You can have the hypo, the sugar can drop. Sometimes it's not like you have refused to eat, but maybe you didn't eat enough. So we have to teach you also, we teach them about the signs of the low sugar.
Okay, so briefly, is there any way of preventing diabetes in children? either type 1 or type 2. Is it something that can be prevented, or there's nothing you can do about it
So
once you are born?
So first off, like what we said, breastfeeding in itself is protective.
Okay.
So mothers are encouraged to exclusively breastfeed their children, and that in itself reduces the risk of diabetes. And we said that formula-fed infants have a higher risk of acquiring diabetes as they grow. Now, another thing that can help prevent diabetes is reducing obesity. So we have to watch our lifestyle activities. So our diet. We need to be very mindful of it. So reducing obesity will reduce the risk of having diabetes.
And these days, kids like to stay indoors and play video games. They don't like to run
so
around.
sedentary lifestyle. So you have a sedentary lifestyle.
So all that is a contributing factor.
But then the other things, the genetic factors, there's not much that we can do about it. But what we can modify are the lifestyle ones. So those ones are the preventable ones that we can do.
All right. So your final words to our viewers. Who will go first? Mrs. Bonnie.
So, like we've said throughout our discussion, diabetes is a multi-system disease, and you always need a multidisciplinary approach in the management. And you need especially the caregivers, you need the input of the child, and then the doctor also plays a role. And then you also have other disciplines playing a role, such as the ophthalmologist and then the dietitian. The ophthalmologist, because of the complications that may result from diabetes. And diabetes is not curable, but then it can be managed.
And when it happens, it's not someone who has cursed the child. It's something that we understand and we can help manage it properly in a hospital. It's not something that has been conjured up by a spiritualist or anybody, and it doesn't need you to go to a church to go and do. In fact, you can bring the child to the hospital and continue praying.
So viewers, I'm sure you've learned so much, and thank you so much, Dr. Mrs. Nanaya Echan Boni and Dr. Mrs. Efua Kwachua Osiu Jemfi. Your names are very heavy. Both resident pediatricians at the Kolebu Teaching Hospital. Viewers, remember that diabetes can affect children. Exclusive breastfeeding is protective. Lifestyle modification with good diet and exercise can reduce your child's risk of acquiring type 2 diabetes. Remember that diabetes cannot be cured, but can be managed appropriately. I hope to see you same time next week. My name is Dr. Vera Bayo. Never forget that God loves you. Bye.